Hello, this is Dr. Funda Goldman, naturopathic physician, and today I was going to talk to you about Marma therapy, specifically the Ayurvedic energy points on the shoulder and upper arm. Before I get further along though, I just wanted to really thank everybody for all the support, all the views, all the subscribes. It really helps me to feel like the work that I'm doing and the videos that I'm providing are quality and of value to people. So thank you very much for that. Note of caution before, again, we get ahead. The information presented here is for educational purposes only and should not be considered medical advice. For any symptoms that are severe or worsening, please contact a qualified healthcare professional. It's always important to determine the root cause of any disease and to develop a comprehensive treatment plan. Individual cases can vary in terms of treatments that are most effective, and solo therapies may not be appropriate or effective in all cases. So, meaning that Marma by itself may not be the best option, but as a comprehensive treatment plan, it might be. So, it all depends. A few words about Marma therapy first. Marma therapy comes from Ayurveda, or traditional Indian medicine. It's more than 5,000 years old and it's non-invasive, so there's no needles or anything that's used, just touch. It's an energy therapy, so it's an energy paradigm of medicine. There are 107 Marma points on the body. So again, in this energy paradigm, you want to start thinking about people, disease, states of health as different kinds of energy and waves. So it's a bit different. And touch is there to allow energies to rebalance themselves. So if you come from another background or training that's more biomechanical or biochemical, where sometimes more gives you more pressure and that sort of thing gives you more effect, that doesn't necessarily work in this system. So, just gentle touch is all that's needed. Usually just 30 to 60 seconds at a point is all that's needed. So you don't have to, longer and harder is not necessarily the best. If you want more history on Marma, I have that in my first Marma video, Marma Points on the Hand, so you can check that out if that's of interest. I also, if you want to know, have an example and experience of Marma therapy, I created a Marma Points on the Hand follow along video, so you can just follow along and have an experience of it, and so also get an experience of how to work with the points. And if you're generally interested in this kind of content, I would look at my Marma therapy, my Ayurveda, and my body care playlist, because I always organize my videos into playlists so they're easy to find. So we're going to be covering 6 points today. 2 of them are actually reviews, so I'll just go through the first 2 fairly quickly here. The first one is Kaksha, which translates as to armpit, and this is a review from my video Marma Points for Breast Health, so if you're interested in that topic, I'd check that video out. But the location of this point is the apex of the axillary fossa, so it's deep in the top part of the armpit there. The energies associated with this point, and again, what I'm about to say may not make much sense to you, but if you're a deeper student of Ayurveda, these are just different energies, and it helps to understand which energies of the body are being affected. So the energies here, the Vyana Vayu, the Pachaka Pitta, the Avalambaka Kapha, and the Shleshika Kapha. So just as one example, the Shleshika Kapha is the kind of lubrication for joints. So that's why this point is good for the shoulder. In any case, so indications for this point, so shoulder and arm, so circulation for the arm, sweating, anhidrosis or lack of sweating, acrid smell, although there are different things that can cause acrid smell. Lymphadenopathy, so if you have swollen lymph nodes in this area of the body, working with this point helps to relax the shoulder. It's good for pain in this area of the body. Rotator cuff tendonitis, brachial plexopathy, so if you have an impingement on the brachial plexus running down the arm that innervates the muscles in the arm and hand, this can be helpful. Although, if it's depending on what's pinching that nerve, you might need something like a chiropractic adjustment to, realign your spine potentially. if that's what's going on, if that's the deeper cause here. And also adhesive capsulitis can be helped by this point. And also breast can be helped by this point. So pain, tenderness, swelling, lymphatic drainage, mastitis, abscess, and cysts of the breast, and also fibrocystic tissue of the breast can be helped by this point. So the second point, also review, is Kakshadara or Skandadara, two names for the same point. These words translate from Sanskrit into bridge or that which holds the shoulder. This point is a review for my Marma points on the chest video. The location of this point is the deltopectoral groove. So the deltopectoral groove is the angle of your shoulder. So if you roll your shoulder forward, you'll kind of find this line running downwards from the shoulder. And it's also where your backpack or purse strap sits typically on your shoulder. So that gives you some indication of where this point is. It's also in the first intercostal space. So it's just right below the clavicle or the collarbone, right in that little corner. Again, if you roll your shoulder forward, you'll find it fairly easily. There's a natural depression that occurs there. You can also find it from the midpoint of the sternum. So if you have your middle of your chest and you go about 7 fingers or 7 anguli lateral to the sternum, this is also a way to get to that point. So the energies balanced by this point are the Pranavayu, the Udana Vayu, the Vyana Vayu, the Sadhaka Pitta, Ranjaka Pitta, and the Avalambaka Kapha. Indications for this point, shoulder and arm. Again, all Marma points have local indications. So pain in the shoulder, arm, bursitis, adhesive capsulitis, brachial plexopathy, tremors, forearm pain, cold hands, neuropathy, so even running down to the hand. This is also helpful with breast tissue, especially soreness and fibrocystic breasts. And it's also, this point's also helpful with the lungs, so general capacity and flow, chest pain and tightness, asthma, bronchospasm, pulmonary congestion, lymph nodes, congested lymph nodes in the lungs, chronic cough, shortness of breath, bronchitis, pleuritic pain, and general movement of the diaphragm can be helped with this point. So shoulders, breast tissue, and lungs helped by Kakshadara. So 4 new points though for the shoulder and on the shoulder and upper arm. The first one's called Urdhva Skanda, and that translates into upper shoulder or support. The location of this point is the superior aspects of the top part of the trapezius, midway between the C7, the spinous process of the C7, that's part of your spine, the kind of big knob. If you follow down from the nape of your neck and go down, there's a pretty large knob that's hard to miss. That's C7. And the tip of the acromion. So the tip of the acromion is actually, if you go down from your ear and follow down the side of your neck over your shoulder, at the end of the shoulder, you'll feel a divot there before your biceps muscle starts. So that's the tip of the acromion. You can actually feel the bone there pretty well. So energies for this point, Pranavayu, Udanavayu, Vyanavayu, Avalambaka Kapha, and Shleshika Kapha. Indications for this point, again, neck and shoulder, stiffness, pain, tightness, radiculopathy or pinched nerve, interscapular pain, degenerative joint disease, adhesive capsulitis or frozen shoulder, bursitis, rotator cuff tendonitis, bicipital tendonitis, and the weight of the world. So a lot of people actually, if you go to a massage therapist, they might work on this area quite a bit because a lot of people hold tension and stress here, especially when they feel like they have a lot of responsibility. This point, because it's close to the neck, and again, if this muscle is tight, it's probably going to be pulling on the back of the neck, and it can cause occipital headache. So that could be helpful in that case. This point's also good for the chest, so it generally increases prana. Pranavayu is the downward movement of flow and of breath. So by increasing prana into the chest, you should be able to kind of relax more and take a deeper breath. And it does actually help the lungs itself. So again, bringing prana into the lungs, shortness of breath, asthma, hiccups, bronchitis, these things are helped at this point. And this point is also good for relieving stress and mental fatigue, calming the mind, and releasing suppressed emotions. So again, there's a lot of mental emotional help with this, working with this point. And this is a pair, so the point on the right is related to the liver, and the point on the left side of the body is related to the spleen. So you can get some benefits for those organs as well, working with these points. The second new point is called Amsha, or top of the shoulder. The location of this is the top of the shoulder and the center of the acromion. So the acromion, again, is like right at the end. If you follow down from your ear, and again down the side of your body across the top of your shoulder, and you start heading down, you'll start to feel that this little knob, which is the acromion, kind of ends, and then your arm is hanging off right there. So the energies involved in this point are the prana vayu, the udana vayu, the vyana vayu, the avalambaka kapha, shleshika kapha, and the kletika kapha. Indications for the point, again, shoulder stuff, range of motion, increased range of motion, pain, stiffness, bursitis, rotator cuff tendonitis, bicipital tendonitis, adhesive capsulitis, or frozen shoulder. And again, you have to consider like what's causing these sorts of issues. I mean, if it's overuse type stuff, you got to work on that. If it's an alignment or bad posture type stuff, you got to work on that. So consider that as well. I actually had a bit of tendonitis in my shoulder the other day, and I worked with these points, and it was great. The next day, the pain was gone. So, but it was just a little, I was just overusing my arm a little bit too much. Nothing chronic or serious. So, this point actually can also be helpful with the ears. So, tinnitus and earaches can be helped with this point. The lungs also helped by this point. Prana, bringing more prana or airflow into the lungs, asthma, bronchitis. They can help the heart, so things like palpitations. They can also help the GI, so specifically the pancreas and issues with blood sugar. This is also a good point for dealing with stress and emotional tension. And this is also a point that can help with fatigue because it helps to increase energy or vitality. And again, like the previous point, the point on the right side of the body is related to the liver, and the point on the left side of the body is related to the spleen. So you can get some other GI involvement with this point. The third point is called Adha Skandha, which translates to lower shoulder or support. And this point, the location is on the lateral side of the arm, so on the outside part of the arm. You might think of it that way. There's a depression, so if you between the insertion of the deltoid and brachialis muscle. So I wouldn't say it's halfway down. It's almost about a third of the way down the arm typically. It's a little bit lower than where they usually give you, if they give you an intramuscular injection in the arm, the intramuscular injection is usually a little bit higher than this because they want to go right into the belly of the muscle there. And this is a little bit lower. You can actually feel, if you go down your arm, you'll feel that there's a little divot, and that's where actually the muscles are meeting. That's where the tendons are. So you want to work in that area. Indications for this point are the upper extremity and shoulder again, adhesive capsulitis or frozen shoulder, pain, bursitis, neuropathy, tremors, poor circulation, such as creating something like cold hands. So again, this is going actually further down the arm, forearm pain, and lymphadenopathy. This point is also good with helping for the lungs, such as lung congestion, asthma, bronchitis. This point's also helpful with stomach issues such as acidity and gastritis. And again, this point is good for stress, releasing stagnant emotions, and emotional disturbance. And the last point, and the last new point, both, it's called Bahu Urvi, which translates to arm vitality. The location of this point is right in the center of the belly of the biceps. So if you make, try to make a muscle, fold your elbow and make a muscle, to make your bicep as big as possible, you want to be right in the middle of the bicep there. So, if this picture is not an anatomical view, so an anatomical view of a person, basically it would be palms forward. And so the biceps is on the anterior part of the body if your palms are facing forward. So this picture is a little bit, it's not an anatomical position, but hopefully you can still find this point without a problem. So the energies related to this point are the Udana Vayu, the Vyana Vayu, the Samana Vayu, the Pachika Pitta, and the Klinika Kapha. Indications for this point include, again, upper extremity. So normal movement, range of motion, tremor, neuropathy, lymphadenopathy, and poor circulation. So again, coordination and again, lower hand, arm stuff. Stomach and pancreas, so again, GI stuff involvement here. Secretion of enzymes from both these organs, nausea, vomiting, and hyperglycemia. And then also lower GI function, so the colon, so things like flatulence, constipation, diverticulosis can be helped with this point. And this is another point that increases energy or vitality, so it might be able to help with things like chronic fatigue and myalgia. But again, depending on what's causing these things. So if chronic fatigue is related to a viral infection, you've got to work on immunity. If it's related to toxicity from like environmental pollution or from your work, like a lot of chemical exposure or paint exposure, like some of my patients have had, you've got to work on cleaning that stuff out of the body. But, you know, in conjunction with that sort of treatment plan, this might be helpful, depending on the person. The other thing about this point is that it's related to strength of will. And the reason why is that it's related to the solar plexus or third chakra, also called Manipura. So it's kind of funny in movies and stuff like that when people are kind of at this point in the movie script where they're kind of gathering their strength, internal strength and focus, and they're ready to, you know, fight for whatever cause. Like, it's kind of funny. A lot of them, they'll naturally kind of fold their arms and their biceps will get big. You know? So there seems to be something natural about this point that maybe we didn't realize, but perhaps Ayurveda has recognized. So here's a summary of the points, and again, all Marma points have local effects. So whenever there's an issue in a part of the body, you probably want to check with points around that part of the body first. All of these points, all 6 points, are good for shoulder and arm. The first 2 points I mentioned, Kakshadara and Kaksha, are helpful with breast issues. Lungs are helped with by Kakshadara and the first 3 new points, Urdhva Skandha, Amsha, and Adhaskandha. Point number 2, Amsha, is helpful with the heart. Point number 1 is helpful with general breathing in of the chest, as well as Kakshadara. Headaches, again, point number 1, which is closest to the back of the head, can be helpful with occipital headaches. Point number 2, which goes kind of straight down the lateral part of the body, can be helpful with ears. Points 1 through 4 can be helpful with different issues related to the GI function. Points 1, 2, and 3 are helpful with stress, mind, and emotional issues. Points 2 and 4 are helpful with energy, vitality. And point number 4, in the middle of the belly of the biceps, is that kind of unusual, unique point related to strength of will and the third chakra. Okay, so just taking a few moments here to integrate them so you have some context, to remember these points. So there you go, another area of the body and their Marma points. So 2 review points and 4 new ones. I want to thank you for your time, and hopefully you found this video helpful and useful. And until the next one, take care.